So Toucan is the West Midlands CAMHS Provider Collaborative. We are a collaborative which includes partners of inpatient CAMHS units, and we also have community child and adolescent mental health service providers as partners. And the vision is that we all work together to make improvements to the mental health services for our children and young people across the West Midlands. One of the things that Toucan is doing across the West Midlands is really thinking about how we can integrate our specialised commissioning with our community mental health providers across the system. So our work with integrated care systems is really important. That includes the integration of our work with our local authorities as well. So we have 6 integrated care systems and 14 local authorities that we're currently working with, and we are really driving with those system partners the transformation for children and young people. It's really important that we really commit to the joining up of health and social care for our children and young people when we're thinking about those new care models and pathways of care.
Quality assurance is a critical component of the work that I and the team within Toucan do. It's essential in providing safe, effective and compassionate care to children and young people that we commission services for. A young person once asked me when I was on one of the wards, "What on earth are you doing here and what do you do?" My answer to them was, I'm here to ensure that the bed you're in is safe and that you're getting a good quality care experience within this service, and that's essentially what the team does. Part of our teams is co-production and family ambassadors. We have a really experienced team of young people with lived experience who engage with our young people and also our provider services to gather the experiences, to support transformation, to support improvements in clinical outcomes and to support improvements in clinical quality. Essentially, they make sure the voices of young people, their families and carers are heard and that we act on this. Our key areas of improvement is ensuring that we have co-production embedded across all of our provider sites, but also into every area of work that we do within Toucan, including service transformation, policy formation, and all of our commissioning intentions. One of the key pieces of work that we've been working on this year, and it's something that I'm really proud of and know young people are really proud of, is the production of a health inequality strategy. We've seen lots of these documents around, but actually this one is one that comes from young people's voices, and they've identified the priorities that they would like to see Toucan working on to reduce health inequalities across the West Midlands. In essence, we'll continue to shout loudly on behalf of children, families and young people to ensure that they get care of the highest quality across the providers that we commission.
Some of our key responsibilities are managing contracts with providers, managing our resources and ensuring value for money, and also reporting on the performance of the services that we commission. So the critical benefits were reducing the number of out-of-area placements, reducing the length of stay, ensuring that those patients that needed to be admitted were closer to home. We also wanted to reduce the spend on exceptional packages of care. All of these, the aim was obviously to improve the outcomes for children and young people, as well as make financial savings. As part of our regular performance reporting, we monitor a number of key performance indicators, but we pay particular attention to length of stay, distance from home, and the number of young people placed out of area. This allows us to make informed decisions on how we best use our resources to improve the outcomes for children and young people. There is still more to do, and our investment plans will see us continue to invest into alternatives to Tier 4 admissions. The number of children and young people admitted to inpatient facilities has reduced by over 50%. Patients that are admitted are now much closer to home, and spend on exceptional packages of care has reduced too.
So I lead a skilled and motivated team who are working together to improve specialised child and adolescent mental health services for children and young people who live in the West Midlands. We're committed to co-production and working with children, young people, their families and those who care for and support them in all that we do. Whilst Toucan is responsible for commissioning inpatient bed facilities for children and young people who may require a hospital admission, we're also doing exciting things to transform how and where this care is delivered. One way we're doing this is through the commissioning and piloting of a variety of new services for children and young people living across the West Midlands region. We recognise the need to ensure that high quality services are available to children and young people in the communities that they live within. This is to ensure that we reduce the risk of the need for an admission. So we're going to be working together on shared plans and making sure that we use the resources that we have available to us to achieve the best outcomes.
When Toucan West Midlands CAMHS Provider Collaborative went live in October 2022, we had a Toucan vision which was about creating a revolution in the mental health transformation for children and young people. I feel that my job within that is to create those conditions of change and lead a provider collaborative and lead our teams around making sure that we improve the life chances and outcomes for children and young people. That's always been the Toucan vision, and that will be the Toucan vision for the next 2 years.